curious to ask you, so how do you use on top of normal treatment, or like they do the exercises with the device? So how does it work, like in
Yeah, it's
medical
meant to, so
terms?
you go through the mapping process and find the spots that are like the engaged spots that you need to treat. And it really just works on the nervous system. It works through an afferent feedback loop to the brain, back to the muscle. Like for instance, the shoulder, you have to move while you're on the device. Once you find the spots, you actually have to move, and you want the patient to move through a range of motion where they feel a spike in the intensity, because we know it goes through an afferent feedback loop to the brain back down. So you turn it up to an intensity that's tolerable. In 4 or 5 reps, they actually stop feeling the intensity again. So you bump it up, they do 4 or 5 reps, they stop feeling it. So that's how we know there's an afferent feedback loop. So the patient has to move while they're on it. So a typical treatment session, somebody would come in, do a little bit of manual therapy, talk to them, ask them how they've been doing. You immediately map the quadrant of the body where the problem is. Whatever interventions you do from a movement standpoint, whether it's Theract, you do that while they're on the machine. Keep it really simple, going from simple movements to more complex movements. And the process of being on the device takes maybe 20 minutes of the entire treatment. And then when you get off the device, you do more manual or whatever else you're going to do with them. But just by adding it as like maybe a third, or less than half of a treatment session, it's really easy to utilize. And each device has 2 distinct treatment centers. There's 2 machines in one, so you can treat 2 different patients with 2 different protocols on one machine. And so that's basically how it's utilized. But we have a whole, whenever anybody acquires the technology, my company, New PT Tech, we do all the onboarding for them. We have, our virtual training courses are approved for CEUs to get a clinical competency certificate. We do Zoom calls with them. We'll even co-treat. We talked about telehealth. We'll even co-treat with Zoom calls with the clinician until they get, well versed. And as travel starts opening back up, I'll start doing more live, on-site clinic visits to kind of help their team kind of get used to basically how to talk to the patient, how to be confident in utilizing it. So that's kind of where we're going at this point. I mean, there's 30,000 physical therapy private practices in the U.S. And if we could be in 10% of them in the next 5 years, we'll be doing well. And that's kind of what we're shooting for.